Yo, what's good? How's everybody doing? How many people seen the RFK Jr. Senate hearing? I saw it. It's pretty damn interesting, man. It was pretty damn entertaining too, man. I mean, hats off to RFK, man. I got to salute RFK, man. I mean, no other politician has dared to even go up against the CDC, man. Um, I mean, you gotta have some huge, you know what's, man, to go up against the CDC. I mean, these people have been known to silence people, um, and in some instances, it's been said that they have been known to unalive people. But RFK Jr. man, he pretty much cooked that whole Democrat Senate panel up there, shaking up the CDC, clearing house. So I'm all for it, man. I'm all for it. I'm all about making Americans healthy, man. I'm tired of living in a country where we rank last in health. Seriously, seriously, we pay the most in healthcare, but we get terrible results from our healthcare system. Because it's not a healthcare system; it's a death care system. Let's just let's just keep it real. And we're the sickest country, we're the fattest country. Um, yeah, we're there. That's not a coincidence. So RFK is in there cleaning house, and man, I'm all for it. Let's get people healthy, man, especially our kids. But anyway, man, I'm digressing. Pretty good hearing. Let's check it out, and I'll give you some feedback and let you know how I feel in certain points.
Hey, can I get this? It's got
All right, looks like they're just now getting in, so might just fast forward a little bit just to get through that, just to get to the meat and potatoes. You know what I'm saying? That's fast forward that. Let's get into the meat and the potatoes. Yeah.
Vital programs like Medicare and Medicaid are sustainable for generations to come. In July, the Centers for Medicare and Medicaid Services, CMS, announced that the agency identified 2.8 million Americans who were simultaneously enrolled in multiple Medicaid or Affordable Care Act exchange plans. Stopping this duplicate enrollment while working with states to ensure that individuals do not inappropriately lose coverage has the potential to save taxpayers $14 billion annually. CMS has also taken steps to provide states with additional immigration information to verify eligibility for federal health care programs. Preserving lifelines like Medicaid for those who are legally entitled under the law will ensure long-term sustainability. Congress has bolstered these efforts by passing the One Big Beautiful Bill. This bill enacts common sense reforms to reduce improper payments and brings needed personal accountability to the Medicaid program. These reforms will protect Medicaid and refocus the program on the most vulnerable patients, those whom the program was intended to serve. The OBBA also created the Rural Health Transformation Program, the single largest investment in rural health care in decades, to help stabilize and modernize the rural health delivery system throughout our country. These accomplishments reflect a vision for a healthcare.
Yeah, I just want to jump in there and say one thing. They keep saying that he's cutting, that Trump is getting rid of Medicaid or whatever, all of that. Actually, man, what they're doing is they're cleaning house. They're getting rid of all of the fraud. They're getting rid of all the illegal immigrants that shouldn't be getting any of those benefits. They're cutting all of that out, and as a result of that, they're saying that he's actually cutting Medicaid, which is absolutely not true. No, they're knocking out the fraud. They're taking away the assets that illegal immigrants are given. If you're an illegal immigrant, you should not be getting any of those benefits. So Trump and them is trying to basically clean that out and take a lot of these immigrants off of these programs, which Medicaid is a big one. Same with California as an example of how Gavin Newsom has given Medicaid to illegal immigrants. RFK Jr., Donald Trump is trying to knock those people off, take them off of Medicaid because they're not citizens and they're here illegal. And those benefits should be given to U.S. taxpaying citizens. So I just want to throw that out there.
System that is proactive, efficient, and patient-centered. While many of the issues discussed today may be partisan in nature, this committee has a deep history of bipartisan healthcare accomplishments. I remain committed to partnering with this administration and Ranking Member Wyden to enact policies that realign incentives in the prescription drug supply chain, expand access to telehealth, and ensure long-term stability in our physician payment system. Mr. Secretary, I look forward to hearing from you today about the administration's efforts to make America healthy again, and how we can continue to work together to achieve this shared goal. Thank you very much. Senator Wyden.
Thank you, Mr. Chairman. As the committee gathers today, the United States is in the midst of a healthcare calamity, the largest cuts to American healthcare in the history of our nation, and they are approaching like an avalanche. Last week, most of the senior leadership at the Centers for Disease Control and Prevention were fired or they resigned after refusing to bow to Robert Kennedy's unceasing crusade against vaccines. I traveled across Oregon last month, and the message was the same.
Rightfully so, and a lot of those vaccines have been linked to autism in American children. So I don't see the issue with RFK, going in on these vaccines, man, because they are injuring our youth. They're injuring the kids, man. Injuring the kids. It's been proven that those vaccines are linked to autism, but once again, these people want to gaslight. Want to call people like myself that don't go along with the BS, a tinfoil hat wearer or a conspiracy theorist, or, oh, you're just anti-science. I'm pro-reality, man. Those vaccines are wreaking havoc on our kids, man. Autism out the roof. Can't deny that. Absolutely can't deny that. But of course, this man right here is.
From one end of the state to the other, families are confused. They're scared about who to trust about their health care. Robert Kennedy and Donald Trump have done so much to feed that mistrust. This morning, my staff, in partnership with Senator Alsobrooks' team, is releasing a report that shows the disaster of Robert Kennedy's 203 days in office. Every single day, there's been an action that endangers the health and wellness of American families. Robert Kennedy.
I don't know. Getting artificial dyes out the food supply, that doesn't seem like that. That's not a bad thing. Taking fluoride out of the water, that doesn't sound like a bad thing to me. When fluoride is linked to bone cancer, all types of cancers, it destroys the pineal gland. I mean, man, I can go on and on. So he's taking that out, man, and I don't see anything wrong with that. Why would anybody buck up against that? Unless you just hate humanity, you know? A lot of these people do hate humanity. A lot of these people are straight up eugenicists, so let's just call it what it is.
Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people. Robert Kennedy's tenure is so far marked by three calling cards. One is chaos at federal health agencies, leaving families, doctors, and the entire nation confused and frightened. Corruption that benefits Robert Kennedy, Donald Trump, and their friends at the expense of taxpayers, and higher health costs for families. I ask unanimous consent, Mr. Chairman, to enter this report into the record.
Without objection.
Then there's chaos. It's been obvious from the start that Robert Kennedy's primary interest is to take vaccines away from Americans. During his confirmation process, he claimed to be pro-safety and pro-science, but his actions reveal a steadfast commitment to elevating junk science and fringe conspiracies. His agenda has not been about choices and information for families. Just last week, he threatened doctors that deviated from the new anti-science vaccine guidelines he released that make it harder for pregnant.
You talking about choice, but you people threaten to take people's jobs away if they don't get the vaccine. Are you talking about anti-choice? That sounds like anti-choice to me. You can't work unless you take this COVID vaccine. I know y'all know what I'm talking about. Am I talking out the side of my neck? I know you guys remember that like 4 years ago. Was it 4 or 5? You couldn't get a job, or in order for you to keep your job, you had to get a vaccine. Or you can't go in this restaurant unless you got a mask on. Or come on, man, come on. And we won't even talk about the man, don't even get me started, man. All the injuries that those COVID vaccines caused, and multiple deaths. We won't even get into that. Y'all know what I'm talking about.
Women and children to get the COVID vaccine. Our statements and actions beg the question, why? Democrats on this committee answered that question months ago. Robert Kennedy can enrich himself and his allies. His family still stands to gain from class action lawsuits against vaccine makers. Now, Robert Kennedy fired every member, every single one of the group responsible for making vaccine recommendations to doctors across the country under the false pretense of conflict.
Yeah, he cleaning RFK is cleaning house, man, at the CDC, and that absolutely that is long overdue, man. That absolutely needs to be done. Nobody should be against that, man. The CDC has proven that they're just not believable and they have no credibility. Nobody believes them. No one trusts them. You lie to the people that many times, you lose credibility, and that's the CDC.
Interest. Meanwhile, many of the new members of the panel are outright vaccine deniers who've appeared as paid witnesses in lawsuits against vaccine makers. Their conflicts of interest and ethics disclosures remain hidden under lock and key. On top of all this bedlam in American healthcare, just 2 months ago, Donald Trump signed into law the largest healthcare cuts in American history to pay for tax breaks for the wealthiest people and massive corporations in our country. Republicans know these cuts are going to hit communities like a wrecking ball. That's why they pushed the most severe cuts until after the election. That's why their members already introduced bills to roll back some of the cuts. Make no mistake, though, those cuts are being felt right now. We're seeing hospitals in Idaho cutting payments, hospitals and nursing homes. Providence Seaside Hospital in Oregon announced their
Yo, you want to know how wicked you want to see how wicked the Democrats are, man? Just look at this hearing. Just look at this hearing, this Senate hearing, and you will know that the Democrats are 100% evil and do not have your best interest at all. At all. Along with the CDC that constantly lie to people and tell people that their vaccines are helpful when it's been totally the opposite. They've harmed a lot of people. So it's pure evil, man.
Down their labor and delivery unit. Every family is going to feel the burden of Trump care in America. Premiums are going to spike next year, especially for those who buy health insurance on their own, but the effects will be felt by those who get insurance also through an employer. Congress has an opportunity to extend the Affordable Care Act tax credits that lower the cost of premiums. Democrats are ready to pass an extension that stops a dramatic premium spike that would force many families to pay double what they do today. Instead of finding ways to help American families pay less for health care, Robert Kennedy is focused on his anti-vaccine mission, fueled by some kind of complex that the consequences be damned. Amid this litany of corruption and chaos, the one point I have to underline is Robert Kennedy puts children in harm's way every single day in America. To my Republican colleagues, I must ask, what line must Robert Kennedy cross before some of you will also join this alarm? This weekend, under the cover of darkness, Robert Kennedy attempted to disappear hundreds of children under his care at Office of Refugee Resettlement facilities. These children here without parents or family were rounded up in the middle of the night and put on planes to Guatemala. Lawyers on the ground described unthinkable scenes. Our staff, some who are here today, were party to this in the middle of the night. And one child said to their lawyer, "Why do they want to send me back? My mom is dead."
And the Democrats are the party of child trafficking. You see how hypocritical, man, these people are? Oh my goodness, man. Oh my, they don't even hide it, man. These before they used to kind of pretend, they used to kind of hide it. They don't even hide it. All those kids that were trafficked under the Biden administration, and you have the audacity to talk about children, like you guys really care about children. No, it's the opposite.
My dad abuses me. Why do they want to hurt me? This was an actual conversation. These actions were illegal. Documents show that many of these children were in the country to escape trafficking in their homeland. Mr. Kennedy calls himself a protector of children. Some kind of rich claiming from somebody who's flown on Jeffrey Epstein's private jet on multiple occasions. I don't think Robert Kennedy should be within 1 million miles of this job. Republicans on the committee had a chance to prevent the public health train wreck that Mr. Kennedy has engineered. Everyone voted for him. It is in the country's best interest that Robert Kennedy step down, and if he doesn't, Donald Trump should fire him before more people are hurt by his reckless disregard for science and the truth. I also would like to note Senator Cantwell has joined us in this effort. I hope.
Nah, RFK is doing a good job, man. Doing a good job. He's shaking up the big pharma. He's shaking up the CDC. And, you guys can't stand it because, well, number one, he's messing with y'all kickbacks, your money. Just call it what it is. Probably the main reason why you flipping out. But no, he's doing a good job, man. He's doing a good job. He's cleaning up the food supply. He's no other politician that I can think of has thought of doing that. I can't think of any. None. So RFK, keep doing your thing, man. You're doing a good job.
At the very least, Robert Kennedy has the decency to tell the truth this morning. Mr. Chairman, I have a procedural request I'd like to make at this time. It's a short one.
Proceed.
Thank you, Mr. Chairman. Mr. Chairman, it's unfortunate that I have to say this, but this is a witness who has lied to members of the Senate Finance Committee. In response to over 35 written questions, including from me, he said, and I quote, that he would do nothing as HHS secretary that makes it difficult or discourages people from taking vaccines. That was clearly not true. His unprecedented unilateral actions to restrict access to COVID vaccines, that alone proves it. He tried to fire the Senate-approved CDC director after she chose the truth over.
These people still pushing the COVID vaccine when multiple countries have already banned it. So what does that tell you? Again, it tells you that they don't give a damn about your health. Because if they did, they wouldn't be pushing that vaccine that killed millions of people worldwide. Multiple countries have already banned it, but our damn country still wants to push this shit. Excuse my language. On our elderly and our young kids, especially our elderly and nursing homes. It's just wicked, man. These people are they're just, man. I don't know, man. Wicked is too much of a nice word. They devils, man. That's what they are.
I consider his delusions. His prepared testimony even today includes the debunked lie that 500,000 children disappeared under the Biden administration's watch, a lie that the Trump administration is using as a pretext to hunt immigrant children and their families. So, my request.
Oh, and RFK has banned a lot of those COVID vaccines. Not really banned them, but he got rid of the mandates, which is basically it's the same thing, pretty much. But yeah, he's doing this thing, man.
Mr. Chairman, and I think it's unfortunate that I have to do this, but given the unprecedented nature of the witness's behavior, I would ask now that the committee formally swear in Robert Kennedy as a witness.
Senator White and I will personally object and will reject your request. We will treat this witness as we treat all of the other administration witnesses who come before us. And let me just say again, as I said in my opening remarks, we will have some partisan disagreements today. We're having partisan disagreements right now, and I am having partisan disagreements with you on your characterization of the facts. The bottom line is we will let the secretary make his own case in his opening statement.
I'll only say, Mr. Chairman, that this committee's unwillingness to swear this witness is basically a message that it is acceptable to lie to the Senate Finance Committee about hugely important questions like vaccines. I think it's a great mistake.
Man, y'all lied and said the COVID vaccine was safe and effective when it killed millions of people and injured lots of people. I mean, wasn't that a lie? Oh, let's not talk about that. No, let's pretend like millions of people worldwide didn't get killed by that vaccine, COVID vaccine. Let's pretend like that didn't happen. I personally know people who died from that and injured. So, come on, man. These people are hypocrites, man. They lie to your face. They pretend like they're there for your best interest, but they're there to destroy you and lie to you. And personally, RFK to me is just exposing them, man.
I made the request. I understand that you're not going to grant it, and you can move on.
We'll get to the bottom of your accusations, but at this point, I'm going to turn to our witness, Secretary of Health and Human Services, Robert F. Kennedy Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crabo, and thank you, Ranking Member Wyden, the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic diseases reach crisis proportions in our country, and finally, we have an administration that is taking action. The Maha Report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the Maha Report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food ties, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
The committee will come to order.
Well, we got a crazy nut job leftist going off, man. Boy, them leftists, they just worship and love their big government and big pharma, don't they? You know the majority of the people who got the COVID shots were people on the far left. They make up the highest people who got the shots. The far left, man, they love their big government, man. They worship it. Go get in line, take 20 shots back to back. They'll do it. Put the mask on. They walk down the street at 90-degree weather with a mask on. It don't matter. You know, our governor told us to do that. So he's God. We're going to put it on. We're going to wear it. We're going to get 20 shots back to back without questioning it. Lord knows what's in it. We don't care. Pretty damn sad and pathetic, man. These leftists. Jeez. Yeah, get her up out, man.
Secretary Kennedy, I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We are ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by
Yeah, Kennedy, man, he cooked that whole panel, man. I'm a fast forward. I want you to see how he just exposed Elizabeth, that Elizabeth lady, the one that claimed she was Native American and got exposed. Yeah, I want to fast forward to that, man. I mean, where's she at? Elizabeth. Yeah, I just passed it. There we go.
Clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
anybody can get the booster.
I'm sorry?
Anybody can get it. Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like
and
this.
That is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get.
Kills me they still pushing this COVID vaccine when it's banned in damn near every country. Elizabeth, you getting kickbacks from that from Big Pharma. We already know that. Like RFK is going already. He going to expose that already, and he has, not just in this hearing. He's done that in other settings, man. So This woman, man, needs to sit down and just shut up, man, cause my God. But yeah, he's cooking the whole panel, man, barbecuing them.
From their pharmacy for free.
$800.
Most Americans will be able to get it from their
No,
pharmacy
the
free.
question is everyone who wants it. That was your promise.
I know
Mr.
I didn't.
Kennedy,
I
not
never
mine.
promised that I was going to
You didn't
recommend
promise-
products with
Oh,
which there is no
sorry.
indication.
When you said,
And I know you've taken $855,000 from pharmaceutical companies, Senator.
did you?
Uh-oh. Uh-oh. Y'all heard that, right? Y'all heard that. Most of them are paid from Big Pharma anyway. Not all of them, but a lot of them do get kickbacks, man, and bought and paid for by Big Pharma. And that Elizabeth lady is definitely one of them. There's a whole bunch of others, man.
Hold up a big sign saying that you were lying when you said that, because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary, you
want me to indicate a product for which there is no clinical data?
Senator,
Is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away.
Obviously,
Everybody can get access to them.
no, they can't walk into a pharmacy the way they could last month and get access.
It
to a
depends on the
vaccine.
it depends on the states.
A year ago,
But they can
it did
still
not
get it.
depend.
Everybody
A
can get
month
it.
ago, it did not
Everybody can
depend.
get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next.
Hell yeah, take them all away. Get rid of all them vaccines. You know what I'm saying? I'm tired of being the sickest nation worldwide. Get rid of them all. You notice these people never want to push natural immunity. You know what I'm saying? Just a little bit of exercise, man. You know, get you some really good high quality supplements. Get you a juicer, man, and just get your fruit and just juice. I'm telling you, man, that would do wonders for your health. You know, melons, you got your medicinal mushrooms, you got your roots, your ginger roots, your turmeric roots. These people never want to push nothing natural, man. It's always vaccine, 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 vaccine. You know what I'm saying? Never want to talk about how elderberry boosts your immunity, protects you from colds and flus. Never hear them talk about that. The citrus fruits. I can go on, man. God has all of that here. We don't need your man-made vaccines. We don't need it.
CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No.
So that
All right, y'all. I'm gonna leave it right there. Anyway, RFK literally destroyed that whole panel, man. He destroyed the whole CDC and he destroyed the whole Democrat Senate up there, man. Made them look like fools, made them look like hypocrites, made them look like the evil people that they are. And RFK just basically sat up there and exposed all of them, man. So I suggest you check out the whole thing. It's on the internet. It's not hard to find. Just wanted to give you my little take on it. I'm 100% for what RFK is doing. We are the most unhealthy country on the planet, and the sickest and the fattest. That says a lot. That says that something is not right. That what we're doing, what they're doing is wrong, is destroying the health of our youth, our kids, and just us in general, people in general, man, with just the toxic stuff in our food supply, the water, the no other country allows this, man. No other government in other country poisons their population like America does its population, its people that they're over. And it's sickening, and I'm just glad we got somebody in office that's trying to do something about it. Long overdue. So let me know what y'all think. I'm signing out. Peace and love. Hit the comment section. Let me know what you think. Hit the like button. I will see you next time. Peace.